Alright. Knock before entering. I'm going to make sure I've gathered all my equipment. I'm going to introduce myself. Hi, my name is Rachel. Nice to meet you, James.
Hi, Rachel.
All right. Is James what you go by? You prefer to go by anything else?
Yes, James is fine.
Okay, I'll be sure to call you James. All right. So I see that you come in today for your physical examination. I'm going to be asking you some questions and looking you over. I will be touching you from head to toe. If at any time you're in any pain or uncomfortable, please let me know, and I'll be sure to stop. Are you okay with going forward with this?
Yes.
All right. So first off, before we get started, I'm going to wash my hands. And I'm going to get some gloves on. All right. Are you having any concerns today? Anything we need to discuss before we get started?
No.
All right. So again, none of this should hurt. I'm just going to work our way, starting at the top and down. I have you get up and down a few times from the table. All right. So I'm going to start by looking in your hair. Thank you. I'm a little on the short side, bending down. So notice first off your hair is nice and shiny. It is clean in appearance, dark color. Do have some moderate graying, but of course that is normal for your age. Your scalp appears to be clean, no excessive flakiness, no abrasions or sore areas or wounds, no rashes. I don't notice any balding anywhere or any alopecia, so everything looks nice and healthy up here. All right, have you stood up looking at your face? Overall, everything looks very symmetrical. Eyes are open evenly. Can you raise your eyebrows for me? Good. Can you smile for me? Frown for me? All right, all of your movements are nice and symmetrical. No deviations from each side. I do notice you have a nice little scar there, but it looks like it's fairly old and nice and healed over. True?
True.
All right. Skin feels nice and cool to the touch, not any excessive sweating, no pallor. Your eyes appear to look nice and even. I'm going to take a look at your eyes a little closer, okay? Sclera is nice and white, no yellowing to indicate any jaundice, no redness. You been having any vision problems lately? Any trouble seeing?
No.
Do you wear glasses or contacts ever?
No.
All right. All right. If I had a Snellen chart in here, we would do a Snellen reading assessment, but we don't have one of those today, so we're just going to move on from that part. Your eyes are blue. Looks like your pupils are nice and even. I would guess them to be approximately 4 millimeters. I'm going to be shining a light into your eyes. What I'm looking for here is to make sure that they are reactive and equal to the light and that they accommodate when I shine a light. So you just look straight at me. Perfect. Perfect. All right. All right, I'm going to do a couple other little tests here now. I'm going to have you follow my finger without moving your head, just your eyes. I'm looking for the movements of your eye muscles here, okay? All right, perfect. And now I'm going to test to make sure your peripheral vision is nice and intact. So if you can see or when you see my fingers coming in without moving your head, I want you to let me know, okay?
I can see.
All right, perfect.
I can see.
Okay, perfect. I would say you passed that one. All right, and it doesn't look like you have any drainage coming from the eyes. Your eyelids are without swelling. Your eyelashes are nice and even throughout. I am going to do one last thing here with this Q-tip. I'm going to test your corneal reflexes. This is not meant to hurt in any way. What I'm going to do is just gently brush this against your eyelash, okay? Perfect. Perfect. All right. All right, next part of the assessment is I'm going to be looking at your ears. The outside of your ears, skin feels normal to the touch. Again, no abrasions or wounds, rashes noted anywhere. Are you having any hearing difficulties?
No.
No? Okay. If I had an otoscope, we could look inside the ears to make sure there's no excessive buildup of earwax, there's no redness or inflammation to suggest maybe that there be an infection. I don't feel any masses and lumps anywhere, so everything looks good there. I'm going to take a look at your nose now. The outside of the nose, again, is pretty symmetrical. You do have the scar. I'm going to look inside. All right, membranes are nice and pink. It doesn't appear to be any lesions inside the nose, no drainage. You having a runny nose or any congestion lately?
No.
Okay. Lips appear good and pink in color, no dryness or cracking noted anywhere, no blueness to indicate any cyanosis. Have you open up for me? All right, good. Can you stick your tongue out? Move it side to side. Perfect. Can you lift it up for me? Look under the tongue. All right. Mucous membranes appear nice and pink inside, no lesions noted anywhere. All right. There does appear to be a missing tooth. Stick your tongue back in. We do have one missing tooth. We have what looks like some dental caries that have been fixed, but no present dental caries. We have a little crowding in there, but it doesn't appear to have any chips or cracks noted anywhere. Have you been having any trouble with your swallowing?
No.
All right, I'm just going to take a look and feel here. Make sure your trachea is nice and aligned and symmetrical. Swallow for me. No deviation when swallowing. Thyroid gland does not appear to be enlarged at all. I'm going to feel one side. Okay. All right, your carotid pulses are even, strong on both sides. All right, I'm going to be feeling down here, under the chin, and down the neck. All right, I don't feel any masses or swelling, any tenderness when I'm pushing here. All right, no signs of lymphadenopathy, so that is good. All right, this next portion, I'm going to be looking into your chest. I'm going to be feeling, and then I'm going to be percussing, which is kind of tapping on your bones of your chest on the front and the back. Then I'm going to listen to your lung sounds in your heart. So I'm going to have you sit up nice and tall for me. Perfect. All right, take a couple deep breaths for me. All right, so chest looks symmetrical when you're breathing in and out. Any difficulties with your breathing? Dyspnea?
No.
Shortness of breath? No?
No.
All right, no barrel chest is noted. No retractions. Take another deep breath. All right, no extramuscular movement. I'm going to be feeling now. All right. Does not appear to have any signs of crepitus noted anywhere. Any tenderness when I'm doing this?
No.
All right. I'm going to be percussing. What I'm looking for here should be what we call a resonant sound, which is the same throughout. All right, I'm going to be coming around to the back now. Okay, good. All of that seems normal. Again, resonant sound heard throughout. I'm going to take a listen now and listen to your lung fields. I just want you to take some breaths for me. I'm going to come around to the side. Big breath. Sorry, and one more. Okay, good. All right, all of your lung sounds are nice and clear. I don't hear any coarseness or crackling anywhere. And again, no shortness of breath with that or any pain. Okay,
No.
good. Any coughing of any sputum lately?
No.
No? Okay, good. All right, next I'm going to take a listen to your heart. I'm going to be listening in 5 different areas here. I'm going to listen first with my diaphragm and then with my bell. I'm going to be doing that because there are certain heart tones in different areas that you hear better with each side. Just breathe normal for me. Okay, so I'm going to listen with my bell. All right, all of your sounds are great. I hear clear S1 and S2 throughout. Your pulmonic, aortic, second pulmonic, tricuspid, and mitral valves could all be heard and auscultated well. The bell is the one I can hear your mitral area with the best. The diaphragm worked better throughout the rest of them. So all of that was, again, within your normal limits. All right, I'm going to feel pulses down here. All right, you have strong and equal pulses. Squeeze my hands. Good equal grips. I'm going to check capillary refill now just to make sure it's normal. Less than 3 seconds. No blueness noted around the fingers, and that's good. All right. Next thing I'm going to do is I'm going to be feeling on your belly, and I'm going to have you lay back for me. All right. Any changes in your eating habits, appetite, anything like that?
No.
When's the last time you had a bowel movement?
This morning.
All right. Any changes noted there? Consistency? No. Okay. All right. I'm going to push. You let me know if it's tender anywhere. Any tenderness when I did that?
No.
All right. No distension noted of the abdomen. It's nice and soft. No firmness or tenderness again noted. I'm going to take a listen for your bowel sounds now. Okay. Bowel sounds can be heard in all 4 quadrants. Not hyper or hypoactive, so that was good. They all sounded normal. Can you sit back up? All right, I'm going to do a couple of tests now that's going to look at the extension and flexion of your shoulders and elbows. I'm going to have you raise your arms up and raise your arms back down. Perfect. To your side and back down. All right, and then just bending at the elbows and back down. Okay, good. I'm going to have you this time raise your arms up against me. I'm going to be testing your muscle strength and try to push your arms up. Great. Back down. Perfect. All right, so no noted muscle atrophy throughout the arms. The strength is the same on both sides. Any pain in doing any of that?
No.
All right. Any issues with urinary?
No.
When is the last time you voided?
An hour ago.
Okay. All right. And didn't seem to have any difficulty with feeling like you still needed to urinate or any pain? No blood in the urine?
No.
All right. Next part of this is we're going to be looking at the lower extremities now. What I'm looking at, I noticed lower legs does not seem to have any edema. No signs of cyanosis are noted. Cap refill in the toes is normal. Tibial pulse and pedal pulse could be found, and they are strong and equal on both sides. Skin appears intact. There is no rashes, lesions noted anywhere. Hair distribution is the same throughout. All right. Have you been having any issues with your gait lately? Any falls at home?
No.
Any issues with your balance?
No.
All right. I'm going to have you lift your feet towards your face. Okay, now push down against me like you're pushing on a gas pedal. Oh, good. All right, your dorsal and your pedal flexion is great. And then, let's see. Next thing I'm going to do is I'm going to check hips and knees. A couple of things we're going to do here. I'm going to have you lay back. All right, I'm going to bend your knee, bend you at the knee, and I'm going to take your hip in and then back out. Let me know if you have any pain with doing that.
No.
No? All right, and then straightening the leg and bending of the knee. Any pain with any of that? Okay, good. All right, can you sit back up for me? All right, so a couple different things we're going to do now is I'm going to have you what we call hyperflex or hyperextend your neck back and tell me if there's any pain in doing that.
No.
No? Okay. You're going to do an external and internal rotation of your neck. Any pain there?
No.
All right. I want you to hold your arms out like this for me with your palms down, bending at the elbow. All right. Now, when you put your palms up like you're going to hold a bowl of soup, any pain there?
No.
All right. And back down. All right. So your supination and pronation of your elbows is within normal. This next one, I'm going to have you put your thumbs across your palms. Any pain there?
No.
All right. So your opposition of your thumbs is good. All right. So can you take a quick step down to the floor for me? All right, I'm going to test the circumflexion of your hips. So what I want you to do is just kind of take your hip out into a circle and back down. All right, and then the other one. Any pain noted with that?
No.
No? Okay, great. This last one is I'm going to have you, you're going to turn your heel in, and then you're going to turn your heel out. This is going to be testing for inversion and exversion of the ankle bones. Any pain or difficulty in doing that?
No.
All right. All right, well, everything is looking good there. I'm not seeing any major issues. Again, can you just flex and extend your knee for me? All right, and then bring your leg, extending your hip up and back down. Perfect. Out to the side and back down. Okay, all right, all of your hip joints look to be equal and good. Extension and flexion is good in the hips and the knees. So, all right, I think that completes our assessment for today. I'm going to, when I step out, you can get your clothes on and get dressed and check out at the front desk. I'm just going to ensure that I have all of my equipment gathered back up. That I'm leaving the room in a nice, safe, and clean area, that I wash my hands, and again, I have left you in a safe environment, and you can get dressed, and that is it.